Hey, what's going on everybody? I am Dr. Caban and welcome back to my channel. I am a general surgeon and a bariatric surgeon in North Central Florida, and today we're going to discuss 7 reasons why you need to do the 2-week liquid diet prior to weight loss surgery. The first reason is an easy one, but don't take it for granted. After all, this is the main thing we're trying to accomplish after bariatric surgery. The better you do before the surgery, the better off you will be. Reason number 1 is weight loss. At the end of the day, what we're trying to accomplish with surgery is to lose weight. This starts with the liquid diet, and in some patients it starts even before that. Many studies have shown that patients that lose weight prior to bariatric surgery do better than their counterpart. The pre-op liquid diet is a low-fat, low-carb, high-protein, and a very low-calorie diet, and for that reason many patients will lose an average of 10 to 15 pounds during those 2 weeks. The weight loss is highly related to your initial weight, sex, and age. For example, a heavier male patient will lose more weight than a lower weight postmenopausal female. But on average, most patients will see 10 to 15 pounds weight loss during the 2-week liquid diet. The second reason is crucial for long-term success after weight loss surgery. This will help your energy, strength, and metabolism. Reason number 2, lean muscle preservation. After bariatric surgery and rapid weight loss, losing lean muscle mass is expected. In an attempt to minimize this effect, we recommend a high-protein diet. This is particularly true after surgery, but starting before surgery can help you replenish your body with healthy proteins that you will need after surgery. Most bariatric programs will recommend at least 60 to 80 grams of protein a day. This is also relative to your age, physical activity, medical conditions, and body composition. A bigger guy with more muscle mass will need higher grams of protein per day than an older female that barely exercises. You definitely need to consult your bariatric team prior to starting this diet if you have liver disease or kidney disease. Otherwise, you can run into issues with the metabolism of the excess protein. Another way to minimize muscle mass loss is with exercise, especially weightlifting. Combining 2 weeks liquid diet with mild to moderate exercise can promote muscle growth or minimize muscle loss. Let's emphasize the word mild to moderate exercise. During the liquid diet, many patients feel tired and weak, so doing any heavy exercise is not recommended, especially if you're not used to that type of activity. The third reason is probably the most important of them all, and is the main reason why bariatric surgeons recommend the liquid diet prior to surgery. For surgeons, this could be the limiting factor between completing the surgery safely or canceling the surgery in the operating room table. Reason number 3, decreased liver size. As patients gain weight, their liver also increases in size. This is due to fat deposits in the liver, also known as fatty liver. During weight loss surgery, we need to visualize the stomach in order to make it smaller. The liver is above the stomach and we use a special retractor to elevate the liver. If you have a significantly larger liver, we might not have enough space inside your abdomen to move the liver out of the way and get access to your stomach. Some studies have shown a drop in the liver size of 25% or more in just 2 weeks of the liquid diet. So don't take the chance, stick to the liquid diet and prevent the disappointment of waking up from anesthesia to find out that your surgery wasn't completed because your liver was too big. Or even worse, that your surgery was done open with a big incision in the middle of your abdomen because your liver was too big for laparoscopic surgery. That not only is going to give you more pain, a longer hospital stay, and higher chance of short-term complications, but it will also give you more complications long-term, like hernias and problems with adhesions and bowel obstruction. So do yourself and your surgeon a favor and stick to the liquid diet. The next reason is the key for long-term success in many things in life, including weight loss surgery. If you cut corners in this area, you are sabotaging your own long-term success. Remember that excuses will never change your current situation. Reason number 4 is mindset and mental awareness. Weight loss surgery, in my opinion, is 90% a mental game, and the 2-week liquid diet is a good place to start that mental shift. The first few days of the liquid diet are going to test your discipline and commitment to the process. It does get easier for most people as your body gets used to the new eating habits. But I do believe that if you cannot commit to 2 weeks of sacrifice, you are not ready for weight loss surgery. Definitely, weight loss surgery is not for you if you cannot commit to 2 weeks of a liquid diet. In several ways, the pre-op diet is going to help you in the immediate postoperative period where you will be in the similar diet. Hopefully, you will also create awareness of calories, portions, and protein requirements that will be very important after surgery. The fifth reason is all about changing your current habits and cravings. What you have been doing until now has not given you the results you're seeking. Now is the time to change. Otherwise, weight loss surgery is only going to be another disappointment. Reason number 5 is adaptation. The liquid diet is low in carbs, and you should continue that after surgery in order to promote weight loss. For patients that crave high carbohydrate meals, the liquid diet will help your body to adapt and stop craving so many carbs. We are creatures of habits. If you give your body cocaine, it will crave cocaine. If you give it caffeine, it will crave caffeine. The same applies to carbs. If you're used to eating desserts and high carbohydrate meals, you are going to crave carbs. We are trying to change those habits. So after the surgery, you can keep the new habits and hopefully lose as much weight as you can. You will have withdrawals for a few days, but then your body will adapt and create new habits. Hopefully, healthier habits that will promote weight loss in the future. The sixth reason could be a matter of life or death. Fail at this and you can have life-threatening complications after surgery. Reason number 6, clean and empty stomach. This is an easy one. If you eat normal food before surgery and you have delayed gastric emptying of any kind, you could have residual food in your stomach. This can put your life at risk. As of today, I had 2 instances where patients had all food in the stomach at the time of surgery. Unfortunately, this was discovered after the stomach was divided during a sleeve gastrectomy and the endoscopy was performed to evaluate the surgery. I found pieces of food in between the staple line. The first patient was a sleepwalker that ate Chinese food the night before the surgery during an episode of sleepwalking. Apparently, this was witnessed by the wife and nobody thought that it was a good idea to let the surgery team know the day of the surgery. The second patient decided to eat chicken nuggets the night before the surgery because she was craving solid food. Both patients did well at the end of the day, but it is not worth putting your life at risk for chicken nuggets or whatever your favorite meal is. Do yourself a favor and stick to the diet. If you're still watching this video, congratulations. That tells me that you're committed to learn the ins and outs of bariatric surgery. Like many other things, the more you learn about weight loss surgery, the higher the chances of long-term success. The last reason is a bonus, but it's definitely a plus. Reason number 7, save money. Now, who doesn't like to save some money? By eating less food, you will save some dinero. And yes, I know you need to buy the protein drinks, but at the end of the day, after several weeks of a liquid diet before and after surgery, you will end up saving some money. Also remember that for many months after surgery, you will eat significantly less than you eat now, and that will also save you some money. When you're looking for protein drinks, shop around. You can find some buy one get one free deals or maybe some coupons online that will save you some money. Also, a lot of my patients like the Premier protein drinks from Sam's Club. You can also get them on Amazon or any other store, but they tend to be cheaper at Sam's Club. I put some links below that you can use to find some protein drinks that can help you through the process. There are many different brands and flavors. I will suggest you buy them as you go instead of buying them in bulk. Many patients after surgery will not like the ones they were drinking before the surgery. The pre-op liquid diet is not the most exciting part of weight loss surgery, but it's a very necessary step. Hopefully this video educates you on why we require this painful step. Every bariatric program is different, so consult with your coordinator to know exactly what you need to do prior to your surgery. If you like this video, feel free to hit the like button. That will help my channel out a lot. Subscribe if you haven't. And if you have any comments or questions, please let me know below. Thank you for watching and I'll see you on the next video.